Stephen Mogusu has elicited mixed reactions from various stakeholders in the health sector, and whereas KMPDU has come out to express their deepest regrets and sorrows for the loss of yet another young doctor, the county government of Machakos has disowned the fallen doctor, claiming he was not under the devolved unit. Zainab Mohammed now reports.
The death of 28-year-old Dr. Stephen Mogusu is one that has elicited mixed emotions from all over the country, with different stakeholders reacting differently to the demise of the young father of one.
I'm sad. I'm bleeding inside.
On one hand, aggrieved KMPDU officials have come out to give the government an ultimatum just one day after the postponement of their strike to the 21st of December. The officials swearing that they will not dismiss their strike this time round should the 14 period elapse without a conclusive agreement.
Healthcare workers in this country have raised grave concerns on their plight and the hazardous working environments in the times of COVID-19. And I'll say it clearly. KMPDU supports the industrial action by the Kenya National Union of Nurses and the Kenya Union of Clinical Officers. Remain on strike until these demands are met. And we reiterate this. We suspended our industrial action for 14 days. 13 days to go today.
The union further claims that the deceased, who struggled to get financial aid for treatment during his last moments, died without receiving a single month's pay for 5 months.
I personally have tried all attempts since Wednesday last week to get the deceased doctor help. I have been in touch with that family, the wife, who also happens to be a doctor, who is out of employment since Wednesday. I was with them yesterday at Kenyatta University Teaching and Referral Hospital up until 8 p.m. They had to fundraise as a class for 200,000 deposit to the ICU.
However, the Machakos County government has refuted claims that the fallen doctor was an employee of the devolved unit, saying that Mogusu was among 16 medical doctors who were seconded to the county by the Ministry of Health to aid in the war against COVID-19.
This issue is being handled also by national government. So the issue of how the medical bills will be sorted, that one I cannot talk about authoritatively, but what I know is that friends, colleagues through KMA.
Meanwhile, the government continues to insist that it is doing all it can to secure the lives of the health workers in the country during this COVID-19 pandemic. CIS Mwangangi even claiming that the government requires more time to address all the issues presented by the medical fraternity.
We have 117 doctors hired under this program. And as we do the counts and checks and balances, we have 15 more remaining who have outstanding dues, and we are working to endeavor to ensure that their salaries and arrears are paid. Of over the 9,000 healthcare workers hired under the UHC program, approximately 8,600 of them have been paid their dues, including all their arrears for the period worked.
This even as the country records a total of 521 new COVID-19 cases, 425 recoveries, and 14 new deaths. Zainab Mohammed, TV47.